Ladies and gentlemen, moving on, we have a renowned specialist nephrologist who runs the Kidney Hub, Dr. Amrish Krishnan, who will talk to us about, in particular, about kidney issues and transplant in India. As we know, this is one of the major issues affecting a lot of Fijians. So I have much pleasure in inviting Dr. Amrish Krishnan to actually share his experiences on the situation of kidney transplant and the treatment available in India and Fiji. Thank you, Dr. Amrish.
Thank you, Rajan, and just a special acknowledgement to His Excellency, the Indian High Commissioner to Fiji, and Medivisor for putting this together. My colleague, Dr. Bharat, who also happens to be my medical school classmate, spoke about the high burden of cardiovascular disease in Fiji. And very similarly, the burden of kidney failure in Fiji is very huge. So when we looked at the incidence of end-stage kidney disease in Fiji, it actually compares to some of the highest rates in the world. And that's because the Western Pacific has the highest rate of diabetes. So there's a lot of people with kidney failure, but unlike cardiovascular disease, where Bharat can send 300-400 patients for bypass, I'm restricted by the availability of donors. And obviously, we want to abide by the Declaration of Istanbul, which guides how organ transplant should be done. So we don't support anything that goes outside the confines of that declaration. So it's challenging, and it's challenging in every country. Even in the other developed countries like the US, Australia, and New Zealand, it's very difficult to get donors for kidney failure patients. They're quite fortunate because they have a deceased donor transplant program, where when somebody dies, sometimes they can give their organ to somebody on the waiting list. So just recapping about the updates in terms of kidney care in Fiji. So dialysis in kidney in Fiji, was attempted as early as the 1960s by a very senior clinician, Dr. Parashuram. And that's amazing when you think about it in terms of timelines. But that skill set quickly got lost with migration of doctors and nurses. So there was a dry spell after the 1960s, all the way up to the 2000s, where people with kidney failure were essentially palliated in Fiji, which means that if you get kidney failure, it's a death sentence. In the late 90s, early 2000s, people started going to India for treatment. But again, you can imagine how challenging that would be, because a lot of people would find out about their kidney failure in the last stages of kidney failure, which means they're short of breath, they're uremic, the toxin levels are too high, and therefore they become too weak to travel. So in the last 3 decades, I think, in the last 2 decades, is when we've started to improve our dialysis services. And initially it was started by the pioneers, the Kidney Foundation of Fiji, and then the other centers started providing dialysis as well. And a lot of our effort in the last couple of years has been to strengthen the quality of dialysis that we can provide to our people, and making sure that treatment is safe. And that is because we want that to be a bridge to transplant. So that allows patients to be able to ask their relatives if they want to give a kidney to them. And in the last 5 years now, I've been sending patients to India for transplant. Like I said, it's not as much as cardiovascular because you're limited, but we do send them, and we've had some fantastic outcomes. In fact, the international operations manager of the Kidney Hub is a young woman who had a kidney transplant about 9 years ago. So she's got a very successful story where I actually saw her from the time when she had kidney failure to her going on to dialysis, and then she went into India to have a transplant. And now, 10 years later, she's actually helping me support other people with kidney failure. So that's a wonderful story. And I think that hope actually comes because India is there and it's accessible. And I think that if we didn't have India to resort to, it would be very, very challenging. Now, I've worked in New Zealand, and the standard of care in New Zealand and Australia is also very good. But the biggest hurdle is the cost of treatment. And when we compare the cost of treatment for transplants, for example, between Australia and India, we're looking at somewhere like 150,000 Australian dollars for a transplant for a foreigner, compared to something in the range of 15 to 20,000 US and India. So it's a vast difference. And so it's been encouraging, and we do try and send as many patients to India as possible for transplant. The other things that the other speakers have already shared, the common benefits of sending patients to India is the excellence in care, the high standard of hospitals that you have in India. I've had the privilege of visiting one of the hospitals where they do a lot of joint replacements, and the quality of the operating theater was just amazing. So before I visited India in these hospitals, it was quite abstract when we talk about when we say state-of-the-art care, but seeing it in person, you realize how much detail and how much effort is placed in making sure that these centers provide very, very high standard and state-of-the-art care. The other thing that I wanted to add is having medical tourism agents like Shushan, for example, really helps facilitate that transfer of patients, and patients feel more supported. The only thing that I think that I want to add is there are a lot of very capable doctors in Fiji as well, just as they are in India. But we are somewhat restricted by the resources that the resource constraints or the environments that we work in because of the challenges. And I just want to encourage the Indian doctors to collaborate with us a lot more, because we want to be part of that process that allows good patient outcomes. Patients will go there for treatment, but they'll eventually come back to us for follow-up. And there needs to be more capacity building. We want to get more of our doctors and nurses trained, and eventually, the language, the level of expertise, I hope will be so comparable in Fiji and India, and it just makes the referral process seamless. So thank you once again. I hope that I can send more patients to India for transplants. Obviously, the limitations, and thank you for giving this opportunity for me to share my thoughts.
Thank you, Dr. Amrish, for that thoughts and sharing of experiences. And yes, we all agree that kidney issue is a big thing in Fiji. And thanks to you, you have been in the news for a long time now, and the Kidney Hub, at least, and with the help of a much cheaper option in India with this, and not compromising the quality of Australia and New Zealand and other places. That's the underlying fact. Every local doctor who has shared their experiences with us, they have all assured us that the cost is less, but the quality is not compromised. It is the best, one of the best, as you can see in any other part of the world.